6 years after we passed the 2006 law, healthcare reform is working in Massachusetts. We've expanded coverage to 98.2% of our residents, 99.8% of children. No other state in America can touch that. That's something I'm very proud of. You should be very proud of as well. While the national trend was moving in the opposite direction, we increased the number of insured in Massachusetts by more than 400,000 people. When you listen to all the tortuous debate about the wisdom of universal health care around the country, I always step back and ask myself, what could possibly be wrong about insuring 99.8% of children? What is the matter with that? Nothing is the answer. There was fear that our health care law would result in fewer employers offering coverage, but the opposite, in fact, has happened. More businesses offer health insurance to their employees today than before the 2006 reform took effect. Some 78% of Massachusetts businesses as compared to the national average, which is about 69%. So-called minimum creditable coverage in Massachusetts includes not only primary care, but also cancer screenings, emergency care, mental health and substance abuse programs, and life-saving medications and treatment. This was the right approach, both to help keep families and individuals healthy and also to save money in the system in the long run. And by the way, we are healthier as a Commonwealth as a result of it. Preventive care is up. More people are receiving cancer screenings. More women are getting prenatal care, and visits to emergency rooms have decreased. 150,000 people have stopped smoking because we expanded coverage for smoking cessation programs. A recent study by the National Bureau of Economic Research documents improvements in physical health, mental health, functional limitations, and joint disorders as a result of increased access to care here in the Commonwealth. Women, minorities, and low-income people have experienced the biggest health improvements. For example, among Hispanic males, a notably underinsured population in Massachusetts before reform, the detection of testicular cancer has more than doubled, and the majority of cases are now detected at an early stage. And with wider access to screenings, we've seen a 36% decrease in cervical cancer in women. By the way, the capacity shortage is real, but a lot less profound than we thought it was going to be at the outset. Over 90% of our residents have a primary care physician, and 4 out of 5 tell us that they have seen their doctor in the last 12 months. And I should add that expanding coverage to 98% of our residents has added about 1% more of state spending to our budget. Those are the stats. Actually, the stories for me are even more compelling. I remember meeting a young woman named Jacqueline Mikolos, a cancer survivor, who got the care she needed to save her life through the Commonwealth Connector. She had no affordable way before Massachusetts healthcare reform. Reform saved her life. She was 28 years old. A self-employed man named Ken Brynildson ignored his gastrointestinal symptoms for 3 years because he could not afford to see a doctor or pay for possible treatments. Once insured, he was seen and treated for stage 3 colon cancer and is cancer-free today. The expansion of access has been a policy success in Massachusetts, I believe, because we started with the belief that health is a public good and that everyone deserves access to affordable care. For us, it's an expression of the kind of Commonwealth that we want to live in. That understanding, that belief was meaningful enough, I think, to compel a Republican governor, a Democratic Senate, a Democratic United States Senator, a wide coalition of business leaders, of organized labor, of patients advocates, medical professionals, and policy experts to come together to pass or invent, if you will, this landmark law, and then significantly to stick together to refine it as we've gone along. And that, I think, is a particularly important point. It's a model for good politics. I'm also proud that what we have here in Massachusetts serves as the model for what the President and the Congress have done for the country. Over the next few years, the whole country will begin to see the benefits of what we pioneered here. And I'm proud of that, and you ought to be proud of that, too. Now, for all of the success of healthcare reform in Massachusetts, there was and is still a separate challenge, one that was intentionally and consciously put off at the time of the 2006 law, and that has to do with the rising cost of healthcare, especially the rapid increases in premiums that people pay. And I always want to make sure that we are clear about the differences between those two. The costs of the system overall are concerning, and obviously they drive premiums. But what consumers and patients are concerned about, what businesses are concerned about, what governments are concerned about, is the rise in premium. In other words, where they feel those rises in costs. Having insurance premiums that rise sharply year after year, even during a recession, is a national problem, not unique to us. Some of the conservative commentators that I listen to want you to believe that this is happening because of our health care reform. In fact, they are wrong. In Mississippi, a state which has not dedicated itself to universal care, the premiums have risen over the same period ahead of the rate of premium increases here in Massachusetts. Nationally, spending on health care increased 6.5% annually in the last 10 years, while real incomes fell by more than 7% over that period. Spending on health care makes up 18% of all spending in the United States, one of the largest single sectors of our economy. In recent years, growth in health care costs has outstripped growth in GDP, even as the share of Americans with health insurance has fallen. Across the nation, just like across the Commonwealth, working families, small businesses, and governments are being squeezed by the cost increases that we could do little about. As spending on health care programs and emergency care grows, it weakens our ability to compete, and it slows job growth. You know all that. This problem predates and is unrelated to health care reform, and it is unsustainable. This is especially true for small businesses. I meet many small business owners who are beginning to see their commercial activity pick up and are ready to start hiring again until they get their annual health insurance hike. Double-digit increases sent businesses scrambling to find new carriers with less coverage at the same price, or the same coverage with higher deductibles and an annual sort of ring around the rosy of shifting plans. I have yet to meet a business owner in Massachusetts, especially a small business owner, who didn't see healthcare costs as a significant impediment to adding jobs. And with small businesses making up 85% of the businesses here in the Commonwealth, if they don't start hiring, then we don't get a recovery. The growth in healthcare spending is also unnecessary. Experts estimate that as much as 20 to 30% of current healthcare spending is wasted on overtreatment, avoidable hospital readmissions, preventable errors, and unnecessary administration. All in, spending on healthcare is $67 billion every year in Massachusetts alone. So that means we spend somewhere between $13 and $20 billion annually here in our Commonwealth that we need not be spending. That's why we've worked hard to find new ways to lower health care spending without hurting the quality of care. In April 2010, I directed the Commissioner of Insurance to disapprove nearly all of the proposed rate increases put forward by private insurers. Now, I know it was ham-fisted. I know that. But it got the ball rolling. We just couldn't accept another year of unexplained double-digit increases in premiums. That decision set in motion a series of negotiations and settlements that led to $106 million of reductions in the base rates carriers originally proposed. Then later that year, I signed a law creating limited network health plans to give consumers opportunities to get great care in neighborhood settings at lower costs. And I want to acknowledge the members of the legislature who are here today and were key partners in this and the other initiatives I'll address in just a minute. There are now new plans, yes indeed. There are now new plans tailored for small businesses, an especially exposed part of our economy, that promise to be as much as 20% cheaper than current rates. We also work to end administrative duplication by requiring common codes and forms from insurers and providers. And now hospitals and insurance carriers have reopened their contracts and cut rate increases, in some cases, by more than half. We've seen the savings already. 2 years ago, average premiums were increasing at a rate of 16 or 17%. This year, they are increasing at less than 2%. We worked hand in hand with insurers and businesses to create limited network plans and small business co-ops, and are working with hospitals, community health centers, and doctors and others to provide pilots for patient-centered medical homes. Now, let me be clear. I'm a capitalist. I respect the opportunity of people to create jobs and wealth, and have spent most of my working life in the private sector. I can't imagine a world without the freedom of people to develop and test competing ideas. But I am not a market fundamentalist. I do not believe that the market always gets it just right at just the right time. And the healthcare industry is most certainly not a perfectly rational market. You are all rational, but the market is not perfectly rational. Consumers don't always know what it is they are buying, how much it actually costs, or what the intrinsic value or outcome will be. People just don't choose a surgeon the way they do soap. For the sellers in the market, there are huge barriers to entry. Most of the major players are not-for-profits, and the product sold or resource allocated by this market is often not optional. The fact is, we made this progress because the private sector and government worked together, and that's critical to keep in mind. With all that we had accomplished, we needed to find a way to sustain the savings we had created for the next decade or more. And I've heard time and again from doctors and patients, from economists and healthcare executives, that one of the main reasons for the high cost of healthcare is the way we deliver healthcare. Many of you and your colleagues have emphasized how a fee-for-service model creates financial incentives for the quantity of care a patient receives, not necessarily the quality. We pay for individual procedures and appointments, not for coordinated care that treats the whole patient. Doctors who treat patients well or help them manage chronic medical problems are not rewarded for those outcomes. There is no financial incentive in the current system for good care, only for more care. What we have is an expensive system that fails to provide the best care to patients or give doctors the tools they need to take control. That has to change. And I believe that the healthcare cost containment bill I signed this summer will help us make that change. First, we've established a cost containment goal. With families and small businesses being squeezed with healthcare costs, we needed to set a goal that was both ambitious and attainable. It made sense to tie the growth in healthcare costs to the growth of the state's economy, since all we're trying to do is make sure that healthcare costs don't outgrow everything else. And so that's what we did. The bill sets a goal for health costs to rise at the same rate as the state economy for the next 5 years, and then at half a percentage point below that for 5 years after that. Second, whatever the goal, the healthcare industry needs flexibility and may need new tools in order to meet it. It's lowering premiums and maintaining quality that we care about, not necessarily the details of every method of care delivery. So we kept faith with that principle in the final bill. Third, it was and still is critical that the industry be accountable for reaching these goals. Government has to have a role in that, obviously working with healthcare experts and allowing sufficient latitude and time for everyone to get there. I'm not interested in government intervention for the sake of government intervention. I remain committed to completing the vision of healthcare in Massachusetts: accessible, high quality, affordable care for everybody. Doing so is in the public's interest, and that's what government is for. That's why the bill I signed gives my administration the ability to work with all of the players to make sure they are doing what they need to do to meet this growth goal. And finally, but importantly, we included sensible tort reform to reduce unnecessary costs for so-called defensive medicine. By the way, that was one of the points we heard loud and clear from medical practitioners. All of this remains about more than just laws, and I'll just finish here. This is all still about values, about what kind of commonwealth we want to live in, and whether we're going to have the will and the energy to shape that kind of commonwealth and do it together. I'm really very, very proud, again, of the fact that such a broad coalition came together to invent healthcare reform here in the Commonwealth, and that broad coalition stuck together to bring us to this next step. And we thank all of you for being a partner, and thank you for having me.